Are there some foods that a mother should look out to avoid?
For recurrent miscarriages?
Yes, especially fruits.
Good nutrition supports all forms of pregnancy. It is very rare that somebody will be severely malnourished to continue to get recurrent miscarriages.
Okay.
It can happen, of course, but it will be obvious that the person is not well fed.
Okay.
Pregnancies are parasites.
True,
but
true.
by and large, to get a good outcome of a pregnancy, we usually advise that a mother should be in a good nutritional state. In a good nutritional state before they get a pregnancy. That's part of pregnancy planning.
Thank you.
Yes.
Thank you so much.
One of the things which causes recurrent miscarriages, which can cause recurrent miscarriages, are fibroids. Now, I need to clarify the situation of fibroids because people have blown the issue of fibroids out of proportion. Not all fibroids cause problems, but there are fibroids according to their location that can cause miscarriages and recurrent ones, moreover. So, for example, this is an illustration of how fibroids can be.
What is this, doctor?
This is a womb.
The womb.
This is a picture of the uterus, the whole uterus, and cut into half and to show what is inside. So down here you have the cervix.
Okay, yes,
normal cervix. And then you have the body of the womb, of the uterus, and these are the masses in the wall. These are the masses, including this and this. Now, as you can imagine, these fibroids, there are those which are right inside, and this is where the baby should be, and these ones can easily cause miscarriages.
That is the fibroid?
Yes, these are the ones which will cause miscarriages, like this one and like this.
They basically squeeze the baby out?
Yes, they squeeze, they compete with the baby for blood supply, usually. So imagine the placenta is somewhere here, and usually these fibroids, as we are getting to understand now, they sort of they are able to produce some hormones themselves, which helps them to grow blood vessels towards themselves. So they are sort of parasitic in terms of blood. Now imagine the baby's placenta does not have that ability. True. And now the fibroid will compete with them.
It is competing with another foreign body in the womb.
Yes.
Okay.
Yeah.
We're going to look at some treatment options that we can have or mothers can go through to treat recurrent miscarriages. And we had an illustration here.
There are a number of options of treatment that are available. Yeah. So first, of course, the first thing is to identify an underlying cause of the recurrent miscarriage. So the health workers will take time to try and evaluate in details and come up with something. And there are some cases where you do not find anything.
You don't find anything?
Yes, actually a third of the cases, 1 out of 3.
So in such a case, what do you do for a mother?
Yes, so in such a case, that's where we do the empirical treatment. Yes. And if it is a lower health center, a lower health unit, those are cases which you should be referred to a more specialized unit.
You talked about empirical, something like that?
Well, empirical, as in it should be, these are treatments which are not based on related to a cause. Oh. They are just there because for the yes.
Okay. Thank you.
So once the cause is looked at and maybe you've identified the cause, there are a number of options you can have. Yes.
Okay.
For example, one of the commonest causes of recurrent miscarriages is the blood clotting disorder in the mother, which I talked about. I think it accounts for about 2 out of 10 of all the cases. Yeah, so if you identify that, those tests can be done in blood, and if you confirm it, you can give blood thinning medication. There are medicines which act against the formation of clot. Okay. And you can give it to these mothers. Okay. And they work well. Okay. They do help. Okay. And
then the surgery?
Yes, and there are some cases which have to be resolved with surgery. For example, the fibroids. True. They need to be operated. Those abnormalities of the womb. They have to be.
Do we operate the fibroids when the baby is still there or after the miscarriage?
That's a good question. No operation on the womb should be done when the baby is inside, unless it is for delivering the baby.
Wow.
Yes.